Hi, my name is Deanna Vesperman, and I am here today to cover some of the basics about bipolar disorder. First, we will talk about what it is. Second of all, we will talk about some of the symptoms. Thirdly, we'll cover the causes. Fourthly, we will talk about some of the treatments. And lastly, we will talk about the effects that it has on our daily lives. Firstly, what bipolar is. Another definition of bipolar is also manic depression. In manic depression, it is basically a chemical imbalance in the brain. There are two types of bipolar disorder. Type 1 is when very few cycles are happening, varying from manic episodes to depression episodes. In type 2 bipolar disorder, the cycles are more frequent and happen often. Right now, there are over 2 million people who have been diagnosed with this disorder. Now, let's talk about the cause. Basically, there is no environmental cause that creates bipolar disorder. It is a genetic defect, and it is usually hereditary through families. There is a technical scientific explanation for bipolar, but would take too long to cover in this presentation. Next, let's talk about symptoms of bipolar. With bipolar, there are two basic cycles. The first cycle is a manic cycle. Within this cycle, you are having feelings of euphoria, that everything is great, nothing could go wrong, that you are invincible. You also have excessive energy and do lots of different things and feel superhuman. You go on spending sprees and start spending money that even though you don't have it, you spend it anyways, and you buy stuff that you want and have no reasoning skills when you're in the store. There is also an increase in your sex drive, and typically you only need 3 to 4 hours of sleep while in the manic episode. Now let's talk about the depression side of bipolar. Mostly there is sadness, hopelessness, overwhelming guilt, irritability, excessive fatigue. There is a decrease in your sex drive, unexplained body aches, feeling sick and ill for no reason at all, and at its worst, severe thoughts of suicide and hospitalization if needed. Let's talk about the treatment of this disorder. Most of the time, psychiatrists will prescribe psychotropic drugs. These drugs include lithium, Tegretol, Cymbalta, Topamax, and other medications of this order. Other medications that are prescribed are known as anxiety medications. These medications include Xanax, Ativan, Klonopin, Valium, and these are all in the same classifications of medicine. It is extremely important that when you're on these medications, you're being monitored on a weekly basis with this therapist who can help you understand mood swings and know which end of the spectrum that you are traveling through and how quickly you are traveling through it. Also too, some of the medications require monthly blood tests to make sure that the levels of that medication within your body aren't making you go into hypermanic stages. Now, let's talk about the effects that this disorder has on a family. First, we'll give an example of manic. In manic, typically you go on spending sprees and you spend money that you don't have. This would make it difficult because you will spend money that would go for bills or food or activities for children. This causes huge issues within a marriage and makes basic decisions very difficult. Now let's talk about the depression end of the spectrum. In the depression mode, all you want to do is sleep all day, you don't want to do anything, you have loss of interest in all the activities with your family, you're extremely depressed, you don't want to talk to people, you just want to hibernate and disappear from everything and everybody. Now that we have covered what bipolar is, what the basic causes are, some of the symptoms, the treatments of the disorder, and how it affects our families in general. Now that you have heard this information, I hope that you take it with you and it gives you an insight into exactly what the disorder is. Also understand that many of the cases go undiagnosed, and if you know someone that has this disorder or displays these symptoms, to please use compassion when dealing and communicating with these persons. Thank you and have a nice day.